World Health Organization is increasing its risk assessment of the coronavirus as the number of cases continue to climb.
We have now increased our assessment of the risk of spread and the risk of impact of COVID-19 to very high at global level.
Now, the coronavirus has spread to 49 countries in just a matter of weeks, with over 83,000 cases confirmed. Joining us now is Dr. Roger Klein, a former advisor to the FDA and the CDC. Dr. Klein, thank you so much for joining us today. When we just talk about the recent developments in regards to the coronavirus, what's your reading of the situation?
Yeah, hi, Seana. Thank you very much for having me. So right now, I think we're in a phase that we need to take this very seriously, and I don't want to minimize the seriousness of it, but certainly in the United States, there's still a very low risk for Americans generally, and we have a small number of people affected worldwide.
Dr. Klein, when we talk about just the risk of infection, I know you're saying that it's important not to, or to take it seriously, I'm sorry, but also not just to overreact, but the risk of infection, how great of a risk, I guess, would you say it is at this point within the United States?
Well, it's extremely low. I mean, we've diagnosed 15 cases here, and then we've brought over another 45. So there's 60 people that we know of who have an infection with this disease right now. So 270 people a year get struck by lightning. We're talking about a very, very small number of people, and certainly it can spread, but we're not seeing, at least by the people we've been testing, we're not seeing an expansion. It's been relatively stable here. So I think right now the risks are very low.
Well, Dr. Klein, how about the fact that some people just don't have any symptoms at all? Does that change the game just in terms of trying to diagnose those that have been infected with the coronavirus, and then also just in terms of how we best contain it?
It does. So that cuts both ways. And we know, for example, in China, we may have almost 80,000 cases there, but there's probably many more people walking around who are either asymptomatic, no symptoms, or who have mild disease. Those people are not coming to medical attention. They're not being tested. So we probably have people who have the disease, many more people than reported in some cases, who haven't come to attention. What that says is that there's greater chance for spread. But it also suggests that it's much less virulent than the initial numbers might indicate.
Dr. Klein, the WHO says hospitals across the world aren't prepared to handle the coronavirus outbreak. When we talk about here in the U.S., I know you're saying that's not a huge risk yet, but are hospitals, as it stands right now, well equipped to handle the coronavirus?
So in my experience, they are. I mean, they'll have to be staffing changes. They'll have to ramp up if, in fact, we see the kind of spread that is possible. But I do believe we can mobilize people quickly, and we can change shifts. And we've got a lot of really great medical facilities here, and I have the utmost confidence that we can handle any future outbreak. I mean, what we're looking at worst case is and don't get me wrong, this is serious, but is a bad flu.
Well, Dr. Klein, there's been there's been many alarming headlines, but when we talk about shortages in regards to supply, we had the first real note of this today, the FDA reporting the first drug shortage amid the coronavirus outbreak. And Dr. Klein, I know that you have advised the FDA in the past. When we talk about drug shortages, how big of a concern is this here for the U.S.?
Well, I think it is a concern. I mean, we have supply chain issues. We're engaged in a world market, so I think we could see shortages that I suspect would be targeted. I'm not thinking that at this point. I don't believe people think there are going to be widespread and mass shortages. It seems that China's getting back on track in terms of enhancing their workforce and their output. So, I mean, I think there's certainly a potential for disruptions. My suspicion is that what we're basically seeing is overreaction right now.
All right, Dr. Klein, thanks for making the time to talk to me today.
Thank you very much.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.